All right, so good morning, everyone, and welcome to our next installment. Now that we're done the sleep section, we're now looks like we're in the digestive system and the digestive kind of cycle of things. So today we're going to be talking a bit about irritable bowel syndrome and how it actually is related to something called SIBO, or small intestinal bacterial overgrowth. So just to get started here, that this talk is not meant to treat, cure, or prevent any disease, illness, or medical condition. This does not establish the patient-doctor relationship by just the attendance of here alone. Just a bit about myself. My name is Dr. Romy Fung, and I am a practicing naturopathic physician here in Richmond, British Columbia. I hold a general practice at the Richmond Family Chiropractic with a focus in treating Alzheimer's disease and dementia. I did my naturopathic medical training at the Canadian College of Naturopathic Medicine, and prior to that did my pre-medical training in health sciences at Simon Fraser University. And I am almost done with about finishing up this research project and having to submit that for next week. So once that is done, you're probably going to hear a big sigh of relief from me, and that everything else that I do for this master's, i.e. the elective courses, is just going to be smooth sailing from here. And I'll be done by August. So that's coming up quite soon. So as a naturopathic physician, I work with looking at the root cause of all my patients. And one of the very common things that come up in my practice is digestive issues. And so one of the most common things that people come in telling me about is that they were told that they were diagnosed with IBS, and that there was either nothing that can be done, or that, very conservative things can be done, but not really get into addressing what it is, because not many people, or not many healthcare practitioners, can really find out what is causing these symptoms. And for some of my patients, they go through a whole slew of testing, whether that be blood tests, saliva, breath, and or stool, and that they're told that they're perfectly fine, that they're normal, and that there's nothing wrong with them. And yet they still have these kind of so-called symptoms of IBS. So today, what I'm hoping to do is to really describe what IBS is and really understand what is going on in the underlying causes. So what's really going on in the body that is causing these symptoms, because I like to connect them both. Sorry, my body is still waking up here, and I'm just about to get there. So, why don't we get started? First off, what is irritable bowel syndrome? Ask yourself, whether that be, have I heard about it? Do I have it? Does a friend of mine have it? Loved one? And really kind of consider what kind of symptoms correlate with IBS. Because IBS is very, very broad. And when I describe IBS, there's a really good picture by Verywell, or verywellhealth.com, that shows that very common IBS symptoms kind of show up as constipation, diarrhea, or typically it's actually a mix of both, alternating constipation and diarrhea. That's also very common in terms of IBS. But you also find abdominal pain and bloating. Your stools are a lot more looser and more frequent, and that you have that urge of going to the bathroom, but you're finding that you're not really completely voiding it, or that you're feeling that you have incomplete bowel movements. So by going to the bathroom and doing your business and coming out, you still feel like there's something that still has to go, and that would come within the next hour or so. And it's also quite common to find mucus in your bowels as well. So this is kind of like the most classical hallmark symptoms of IBS. But when one gets diagnosed with IBS, especially with medical doctors using something called the Rome criteria, which we'll go through in just a moment, they look at your frequency and also your habits. And with this, by irritablebowelsyndrome.net, looking at the subtypes, you might be given IBS as kind of that diagnosis, but there's something called IBS-C, which is IBS with predominant constipation, where more than a quarter of the time you're getting the constipated, very hard stools that are kind of like lumps. Then there's IBS-D, or IBS with predominant diarrhea, where more than a quarter of the time you're getting the diarrhea and the liquidy stools and bowel movements. And then there's something called IBS with mixed bowel habits, where you get a good kind of proportion of your stools that are both constipation and diarrhea. So you're probably looking at the top here, where it says stool type 1 and 2 and stool type 6 and 7. Now, what does that mean? So this comes to something called the Bristol stool chart. And if you've ever seen any naturopathic doctor, they're likely going to bring this chart out at any point of our consultation, because looking at how things come out can really determine how our digestion is on the inside. And so we can talk about and kind of tell what's going on in regards to hydration status, digestion, indigestion, and the microbiome. And so when we talk about types 1 and 2, as we indicated in the previous slide here, at the top here, we're talking about stools that are very hard to pass, that are like hard lumps or like nuts. In some literature, they like to call these cannonballs. I don't know if that was ever appropriate, but these are the ones that are quite hard, dense, and almost quite dry, as if you're very dehydrated. And that's probably one of the reasons why you would have stools under type 1 and type 2. And then we get on to the other end here at type 6 and type 7, where it's entirely liquid or very fluffy, almost has no shape pretty much. And that's the diarrhea end of things. And we would associate this with infection and so forth. What we're trying to aim at here for most of the healthier patients is something along types 3 and 4. Something that has a really long shape like a sausage, and having just a few cracks of it is perfectly normal, but we're really aiming for type 3 and type 4. But you can always, I have my patients print this out and post it right next to their toilet and disregard what their family members say about it, but just tracking what their stools are like, because that will tell a lot about what's really going on in your digestion. And that way we can figure out what your bowel habits are typically are, and what the kind of like the schedule and the patterns are like. Is it really that, are you only getting stools with type 1 or type 2, or stools with type 6 or 7, and or both? And how frequent? These are things that would really tell us, a naturopathic doctor, a lot about what's going on with your digestion. Because when someone comes in with this kind of IBS and was told that, there's nothing can be done, there's that misconception. And that's why I wrote here, IBS is not really a catch-all diagnosis. There's a common misconception that IBS is a really default diagnosis when someone goes through seeing the medical doctor or several medical doctors and finding that there's nothing actually wrong with them, having done all the blood tests, stool testing, etc., x-rays, biopsies, etc. doesn't mean that we can actually diagnose this in the process of elimination. The fact that we've ruled out all these things and that it's not diagnosable at all. But in reality, clinicians, including myself, when they see IBS, typically only see it as the Rome criteria. And this is where I work things further on after that basis of the diagnosis through the Rome criteria. So what I mean in layman's terms is that the criteria, the Rome criteria, indicate that people with IBS suffer from chronic, but waxing and waning, so back and forth, abdominal pain and irregular bathroom patterns that range from very loose, frequent, and or urgent bowel movements to very hard, incomplete, and or infrequent bowel movements. So in order for a diagnosis to actually then occur, you need to have these kind of symptoms at least once a week for 3 months for a diagnosis then by the conventional side to be considered. And that similarly, a lot of people say that IBS is a psychological condition. And yes, while stressful situations can really aggravate IBS symptoms, that is typically likely due to underlying physiological, so body differences that make people more susceptible, people with IBS more susceptible to the effect of cortisol or stress hormone that we talked a lot about, or physical symptoms. So in other words, there's a big difference with IBS being caused by stress versus aggravated by stress. I mean, after all, if it is caused by stress, then all of us would have it, and stress relief measures would then cure it. But that's typically not the case. So this brings me to the next part. What about SIBO? Because there's a lot of research right now showing that SIBO is considered an underlying cause to IBS. And as research has shown that up to 84% of patients with IBS also have SIBO. So first off, what is SIBO then? Even though when people come in with IBS and say that there's no known cause, there's no known cure for IBS, that if you successfully and effectively treat the SIBO in these cases, that all of the IBS symptoms tend to go away permanently. So SIBO, or small intestinal bacterial overgrowth, is a condition in which you have a bacteria, hence the term bacterial overgrowth, in the small intestine. So you have to think about what is actually going on with the digestive tract and the function of the digestive tract. And this is where I tend to test my audience, specifically a live audience, what the difference is between the small intestine and the large intestine. Because one of the most common questions is, but I thought that bacteria, especially good bacteria, is meant to be good throughout, the digestive tract. And in part, yes, it is true, but we actually want that bacteria to be more so in the large intestine. So that's this ascending, transverse, and descending colon right here at the end of your digestive tract. Because that's where most, if not all, of the fermentation and creation of vitamin B and vitamin K with the help of bacteria happens. But when you have bacteria that is growing in the small intestine, things can really happen. In fact, when you take into consideration how much bacteria should be in each part of the digestive tract, we find that about only 3% of all your gut microbiome, gut bacteria, should reside in the small intestine. No more than 3 to 4%. And that's a very small amount for such a long tube. And we learned this tube to be about six meters or 6 feet long. Sorry, 6 feet long. And that the rest of it should be in this large intestine. So when you have bacteria in the small intestine, first off, we need to figure out, what does the small intestine do in the body? Turns out that we need our small intestine for a lot of our digestion, assimilation, meaning sorting of our nutrients, and absorption of our nutrients. Now, this doesn't happen in the large intestine. It only happens primarily in the small intestine. And what happens when you actually add bacteria in the picture? Well, I say bottom line is that they hijack this digestion. And because once you digest certain foods, they become their building blocks. So they become so basic and so refined that absorption is so easily done, not just by the body, but fermentation of those sugars can be easily done by the bacteria. And with bacterial fermentation of sugars and fibers found within the food in the small intestine, that can create a lot of gas. Because fermentation, or what is the process of fermentation? It's to ferment something, but then your byproduct is going to be gas. And that can lead to bloating. If your gas is keeping contained in the stomach or in the abdomen area, and that you're constantly fermenting, or the bacteria is constantly fermenting the foods, that could lead to expansion of the abdomen, leading to we call bloating. You probably have seen people who are, maybe 3, 4, 5 months pregnant after a meal, and that it can be a very uncomfortable feeling. And it could be quite painful. And you might have symptoms leading to burping, flatulence, so passing gas, heartburn, and that these gases can actually irritate the bowel, leading to diarrhea and or constipation. So is it really that the bacteria then can be the underlying cause of this? And its potential, if you think about it in the connection where by creating and by fermenting foods, creating the gas, and leading to that bloating symptom plus diarrhea and or constipation, it kind of makes sense. So in other words, you must most likely not have IBS, but actually something called undiagnosed SIBO. There's a research done in 2003 that 84% of IBS patients showed an abnormal result on something called a lactulose breath test. Now, you probably have done breath tests specifically for H. pylori, and that H. pylori is more so for the stomach. Sorry. I keep on forgetting the garbage man. And so that means 84% of patients diagnosed with IBS is actually tested positive for SIBO. And so by doing this breath test, it's not that we're testing for H. pylori, but actually by providing a sugar called lactulose and ingesting it and leaving it so that it goes down all the way into the small intestine. If there is bacteria that inhabits the small intestine, you'd be getting that bacteria to ferment that sugar and creating a gas, which then you can actually breathe out. And that's the basis of how we test for SIBO, which I'll talk about later on. But they're finding that patients with IBS are exhibiting more breath or exhalation that contains a lot more hydrogen gas. So with that, we're going to find that with this gas, that can lead to abdominal bloating. discomfort, especially when it expands your abdomen, your stomach, to the point of stretching. You might get some of the gas to go up or down, leading to burping or belching and or increased flatulence or passing gas. It can also lead to heartburn because it could really affect the stomach area, as well as nausea, and then the hallmark symptom, diarrhea and or constipation. And looking at the literature, this one is done by SIBO doctors. There's a really well-known doctor who focuses on SIBO, Dr. Preet Kangura, and he has found that SIBO can be actually the underlying cause and associated with a lot of different conditions, such as acne, anemia. Why we talk about anemia, and we got one individual asking about iron deficiency. Well, turns out that some of the bacteria can actually hijack iron. And for a case, a sample case is someone who is anemic, very low in iron, and is supplementing iron. And even through a couple months, a month to 3 months of supplementation of iron, their ferritin levels, which is the iron levels you test for iron, are still not going up. And some of those underlying reasons can actually be SIBO. With SIBO hijacking iron, that prevents your body from absorbing iron supplements. But other things can include GERD, dyspepsia, so that's your acid reflux symptoms, low stomach acid, thyroid, here's the big one, irritable bowel syndrome. And we talked about leaky gut syndrome too. SIBO can actually be quite associated with leaky gut, leading to the passage of undigested food that shouldn't be going into the body in the first place. And many other conditions. You can find this if you search up SIBO doctors on Google. So next point is, how do we then test for SIBO? Well, as I just brought up in the image shortly above, there's a recent study in 2010 that showed that people with IBS exhale more hydrogen than healthy subjects in the fasting state. And that's potentially because if they're harboring that mix of bacteria in the small intestine, that they're exhaling a lot more hydrogen because of the fermentation of the sugars that the bacteria is conducting in the small intestine. So one of the ideas here is to test it through something called a lactulose breath test. And with a lactulose breath test, this is where we ask a patient to ingest a sugar, such as lactulose. There are some tests that do glucose, but we find that lactulose is more effective, especially throughout the small intestine. And what happens is, once that lactulose enters the small intestine, the bacteria then that is harboring, or we're suspecting the bacteria that's harboring the small intestine, to then ferment it and to create a gas with it. And we ask the patient then to be breathing out into this blue bag here every 20 minutes for 3 hours. So we get a total of then 10 vials, each one at a specific time. And then we can actually indicate and find out at a specific time when is that peak of hydrogen or even methane gas can show up. And this tells us likely where in the small intestine the growth is, as well as how much you're exhibiting. And this can be shown here in the sample report, where we have 2 lines here. So first off, we take 10 samples. So for a total of 3 hours and every 20 minutes. And from there, we send it over to a lab that can test for how much or how concentrated hydrogen as well as methane gas. Now, you're probably going to think methane. I thought only cows make methane gas, but different types of bacteria can produce different types of gases, and hydrogen and methane are two common ones, but not the only ones. There's other gases too, such as hydrogen sulfide. And sulfide is the one that is the culprit of the distinct scent that you get from passing gas. But in this result here, we're finding that this yellow line is indicating hydrogen, and that hydrogen is really rapidly increasing up to about 160 ppm, versus methane, which is still staying low, but you don't really need much methane then to actually find out that you have a SIBO. But for hydrogen, you don't really want them to be going over about 40. So this patient here is really exhibiting a lot of hydrogen gas in their breath tests. And thus, I would be suspecting that this person might be getting a lot more diarrhea than constipation. But even so, it takes just a bit of methane just to make that symptom of constipation here. But this is a really common test that I do with a lot of my patients coming in with clear symptoms of IBS, just so that we get a picture as to, is it really hydrogen or is it really methogenic SIBO? And then we treat accordingly. So in regards to treatment, there's a lot of resources out there in regards to conservative treatments, so treatments to do with diet and such. But the point here is, if we're finding that bacteria shouldn't be in the small intestine in the first place, the most effective way is to eradicate it. So this is where I utilize and give my patient a choice of 3 choices, whether we go through herbals, and there are a lot of herbs that could really be beneficial for eradicating a lot of the bacteria associated with SIBO. There are also supplements that are more concentrated, and that could be beneficial as well. There's also pharmaceuticals that a naturopathic doctor with prescribing authority can prescribe. The most classic one, and the one that has been only researched for SIBO, is something called rifaximin. But the only thing about rifaximin, at least here in BC or maybe Canada as well, is that it's not covered by MSP. So because I'm talking about SP, it's definitely BC, but it's not covered by MSP. And a typical dose, a dose schedule for rifaximin is typically onwards to about a couple hundred to a few $100. So that's quite pricey in itself. But when I treat for SIBO for my patients coming in with the irregular bowels and the bloating and such, we tend to go through something called tincture, which is concentrated herbs steeped in alcohol. But there are ways to conservatively control the symptoms. So because we're dealing with bacteria, we have to find out foods that then the bacteria is not going to ferment in the first place, or ferment not as much. And that is the basis of something called FODMAPs, which you've probably heard of. And FODMAPs is an acronym that indicates fermentable oligo, di, and monosaccharides and polyols. So that's a long name, but what that means is these are carbohydrates, these are sugars that are poorly absorbed in the small intestine, and thus gives the bacteria a huge opportunity to ferment the foods and thus create the gas. So you can actually find this in a lot of infographics and resources online if you search up FODMAPs. This one here comes from the Dempster Clinic. But with the fermenting of gut bacteria, your body processes carbs by, we tend to process carbs by breaking them down to simple sugars. And then these are then absorbed. But if you don't have these enzymes that really digest these foods, in other words, fiber, foods high in fiber, for example, that these foods then can travel across the small intestine and into the large intestine without being digested. And thus, these compounds are fermented by the trillions of bacteria that call your gut home, leading to that gas production that can trigger bloating, stomach pain, constipation, and diarrhea. So there's the FODMAPs diet. Then there's something that is within the realm of FODMAPs that Dr. Becker has done a lot of clinical observations and experience on, and that's something called the SIBO specific diet. And this is the handout that I give to all my patients. And what it shows, I like it because it has the color of green, yellow, and red. So foods that are red or illegal, you'd want to be avoiding because they have more of the sugars that are fermentable, and the green being they have more of the sugars that are less fermentable, so that you prevent the bacteria from fermenting these foods in the first place and reducing the symptoms of the bloating. So this food guide goes through the different types of food. So this one shown is just vegetables, but we have meats and carbohydrates and fats and oils and so forth, and fruits. So it gives you an idea as to what foods can you prevent the bacteria from fermenting, but the best way is to get rid of the bacteria in the first place. Unfortunately, that means you have to kill off that bacteria and make sure that whatever you kill off, that you might also risk killing off in the large intestine, that you then make sure that you get the ball rolling by getting the bowel stimulated, and that's through other means as well. But typically a phase of treatment with SIBO then is the first phase, eradication. This is where we have to eradicate the bacteria that's in the small intestine. And then we have to get the small intestine moving, because one of the big questions is, why did it stop moving in the first place, leading to this collection of bacteria? Because there's something called the migrating motor complex, which we've learned in school, something called peristalsis, and that moves food along the digestive tract through rhythmic contractions. But the migrating motor complex is a more finer movement. I almost like to call it like a conveyor belt that moves bacteria and very small, fine particles forward to make sure that, one, it goes through the small intestine, but two, it prevents the bacteria from falling back from the large intestine. So we have to get that moving, and that's through a lot of lifestyle, habit, and certain nutrients that can really get things moving. And then three, the third phase, if we haven't done so already, is to re-inoculate. And that is part of the 4R approach that you've heard from last week, where we make sure that your body is getting back the bacteria that we might have killed off, and making sure that that goes straight into the large intestine. So all in all, we're finding that with the evidence that we're seeing today, that SIBO is potentially a primary cause of IBS, and that it is caused by the bacteria that is in the wrong place. I mean, we want the good bacteria, but we want that good bacteria to be in the large intestine, not the small intestine. So ideally, we want to test first to see how much is harboring and what kind of gases you're actually exhibiting, and then eradicate accordingly. There are diets out there such as the FODMAP diet and the SIBO diet, which can reduce the symptoms because you're reducing the capability and the ability for the bacteria to be fermenting sugars that we cannot digest in the small intestine. So I hope that was a very quick talk right there. Thank you very much for listening. If you haven't done so, follow me on social media. You can like me on Facebook, and we talk a lot more about the digestion and such, as well as YouTube, where this video is going to be recorded. If you need any contact info or any more information, that you're more than welcome to contact me at contact@drromyfungnd.com, as well as www.drromyfungnd.com. I will stop right